Father Kirk. Welcome to Kirk Eye Center. I'll be narrating a standard cataract surgery of mine. The corneal surface has a slight dryness here. I'm making a 1 mm side port incision. The corneal surface was marked with an outline for which to follow as I open the capsule when we initiate the capsulorhexis, which will happen in a few steps. Through that side port, I'm now instilling some anesthetic, lidocaine, non-preserved, to help keep the eye comfortable. That's the only time at which a patient will feel a slight discomfort for a second or two during the cataract surgery. After that, things should be painless. This is some space holding substance called viscoelastic, a dispersive type, which will help hold stability in the chamber as the cataract is removed. This is the main incision. A keratome blade is used for that, 2.4 mm incision, so fairly small. You can see just a touch of blood at the margin of the incision. That is intentional. Uh, that will reduce risk of infection tenfold over an incision that's made just clearly into the cornea. And so anything we can do to minimize infection is a good thing. And here we're creating an opening in the capsule with first a cystotome or a bent tip needle, and then now these Utrata forceps, which have a special narrowing at the side of the incision, and so there's less likelihood for ore locking. Hydrodissection is now cleaving the nucleus of the lens from the cortex so that it can be movable, and that will allow it to be easier to remove the nucleus of the cataract. This is our phaco emulsification unit, and we'll be using its ultrasonic energy to break the lens into pieces. First, sculpting a groove for which to crack the nucleus of the lens in half. And once I've sculpted down to a depth where I can see a slight change in the coloration, I will bring in a second instrument through that side port, and now I can crack this nucleus into half. And now I can sculpt out another. And this is a divide and conquer technique, and then removing these quadrants. The fluidics of the phaco emulsification are excellent. You can see I'm not trying to place any undue stress on the incisions and just moving the pieces towards my phaco emulsification tip and removing the nucleus of the cataract, and everything going smoothly. Now this is irrigation and aspiration. So irrigation to keep stability in the eye, while the aspiration will remove the cortex of the lens. Now this is balanced salt solution on a cannula with a little plastic sleeve used as a squeegee to clean away any remaining cells along the back capsule or within the area of the former lens. And now this is more dispersive viscoelastic, which will be easier to remove at the end of the surgery, but allows a space for the new lens implant to be placed within the capsular bag where the old lens sat. And you can see the folded lens now unfolding into position in the capsular bag. And it has those haptics off to the side. The optic will be what will allow this patient to see clearly again, but those will help center the lens in that capsular bag so that the patient has a nice clear view. And this is a very biocompatible acrylic material for this lens implant, and it is going to be well accepted by the patient, irrigating out that dispersive viscoelastic now with irrigation and aspiration once more. And now I'll hydrate the wounds, and the eye will be checked to make sure the pressure is adequate and slight amount of moxifloxacin instilled into the eye to protect from infection. Thank you for watching.